Here's why I think you'd really love to be in Bridging the Gaps. Number one, it's really a lot of fun. Number two, you learn a lot. Number three, you give back a lot to the community. And number four, your consciousness is raised. Your framework is broadened in terms of thinking broadly and deeply about the problems facing urban communities that really, I think you will be in a unique position to understand at a level you never could if you stay in the classroom or just work out of clinics and offices and hospital settings. So really, this is a chance to step outside of your comfort zone and understand what the challenges facing healthcare providers in the United States for decades to come. This will be part of what you will use as something to go back to inspire you, to challenge you, and to broaden your view as a future physician.
The importance of bridging the gaps in this day and age is really to bridge the gap between clinical medicine and community. You as professionals also are going to have to learn to work in teams, and one of the beauties of this program is that you will learn who your future colleagues are. Dental, vet med, ironically, is going to be a very important part of the future. Nursing, social work, PT, OT. So you will learn that you cannot provide care in a vacuum, that you have to provide it as a team.
I am currently an assistant professor in pulmonary and critical care medicine. I'm also one of the associate program directors for the internal medicine residency program. Being involved in Bridging the Gaps as a summer intern really mostly opened my eyes to the community in which I was learning to be a doctor and which I hoped to become a doctor at the time in the future. I think that until then, even having gone to Penn as an undergrad, which I hadn't really developed an understanding for the community in which Penn resides. And actively working with members of the West Philadelphia community as part of Bridging the Gaps was something that really helped me to understand the people with whom I'd be working, with whom I'd be serving as a physician and as a medical student, and made me want to work with an underserved population for part of my career, regardless of what shape my career took in the future.
I worked at Earthkeepers, which is an urban farm in Southwest Philly. It got me really interested in nutrition and the idea of food justice and how that affects health. One of the cool moments was when some young kids came in for a tour and they were really excited to see the vegetables actually growing on the plants because they'd only ever seen them cut up and packaged in a store. So kind of the idea that we've become very distant from our source of food and trying to bring people back to that. It's a not very difficult time commitment, but you get so much out of it. You get a lot of input into where you work. So depending on your interests, there's so many different sites where you can work. And then every week you get to meet with tons of different students from all over the city that you never would have met otherwise. You get to go to their schools, see what their schools are like. I can't think of a better way to meet, incredible mentors and friends and colleagues. And it's a lot of fun.
I participated in Bridging the Gaps over the summer of 2013, so after my first year of medical school. I was at Hall Mercer, which is at 8th and Spruce, so it's in Center City, but I was working with kids from all over the city. Kindergarten-age children who had various mental health diagnoses, and a lot of them came from a background of trauma. I think it had a huge impact on my career. I came into medical school thinking I would do scientific lab research, and I did this kind of as a test to see what my other interests were, and I'm now taking an extra year to get a public health degree, and I think a lot of my inspiration for getting that degree is because I loved working in the community so much and I want to incorporate that into my career as a doctor.
I spend a lot of time at Prevention Point Philadelphia, the city's syringe exchange program, and we have had Bridging the Gap students there for a number of years. And I find it wonderful to be able to get folks out there to see the way the IV drug using community interdigitates with the health system, with Prevention Point, with other services. Because what I really strongly feel is that you really can't only learn medicine from the hospital, certainly, and even if you talk about clinics and in the standard medical clinic that someone would go to, you really need to you're not going to be capturing all of your patients that way. You need to see what a lot of your patients, particularly in an urban setting like Philadelphia, are experiencing out in the community and what their reality is. And when you start to see what their reality is, it helps you better to take care of the whole patient and to improve their medical care overall.
I just finished my first year of medical school, so I was interested in hearing their stories. So I got the chance, which we don't get to later on in medicine, to listen to patients and to hear what their lives were like, to hear what joyful things were happening to them, what things worried them, to hear them talk about the doctors they had seen and how they were trying to manage their health. I mean, at that point, I really just enjoyed it, but I didn't realize how beneficial it was going to be later on, because then, during my clinical rotations in medical school, I still would take just a few minutes at the beginning. There's always time pressures to keep going, to get things done. But just a few minutes at the beginning to just listen, because I had learned in Bridging the Gaps how valuable just a couple minutes just listening to what the patient had to say was, because you form this bond with the patient that then carries over into all these later interactions with them. So, and I also didn't realize at the time that now the majority of my time really is now spent doing research. And because of the emphasis now on patient-centered outcomes research, I didn't realize how important that learning to listen was also going to be for my research. Because now there's a huge interest in getting patients to talk about what outcomes matter to them and what things are important to them. And so that listening from Bridging the Gaps could carry over into my future research, the research that I do now as well.
I don't feel like the individual who's taking that program has to be committed from the door that they're going to have a job in the community, or essentially solely based in the community or with a community-based organization. I do feel, though, that no matter what their level of participation in this program, it will enrich and complement any professional track that they decide to take in the future, because they'll be able to approach their career and their objectives, their initiatives, whatever you want to call it, with insight that other individuals who don't get a chance to communicate or connect with the community will not have. So I do think on any level, it amplifies what they're able to do. And if they decide that community health is what they need to do, then great, they've got even a bigger leg up on everyone else.
If you're a Penn medical student and this is something that is important to you, you can become a Bridging the Gaps clinical scholar. And what that means is that you would do the Bridging the Gaps community health internship program, which would be the 7-week intensive community embedded program. You would also do the seminar series, which is an 8-part series that you can do throughout your 4 years of medical school. And then you would do a rotation at one of 3 sites, Prevention Point, Covenant House, or Penn Life. If you complete all 3 of those program components, you will graduate with a Bridging the Gaps Community Health Certificate, and you also will graduate with a citywide Bridging the Gaps Clinical Scholars Program Certificate.
As a Vice Chair for Education and Residency Director in the context of post-medical school education, I know that residency programs look very closely at what were some of the non-classroom based or non-clinic based activities that students take on. And whenever I see Bridging the Gaps as part of a student's portfolio, I'm always pleased to see it, and I ask about it. It's something that distinguishes students in the minds of residency directors. And I think that that's an important consideration as you wonder, well, what does my summer look like in the future? How will it be looked at by those who are judging me as to whether or not I'd be a good candidate for their residency? And being able to say that you were part of Bridging the Gaps and to speak to the issues you addressed, the projects you worked on, and the learning that took place really is a phenomenal asset to your future plans in terms of residency choice.